That's it. It just looks kind of funny where it is.
Yeah. Okay.
Can you step back a little?
Sorry.
So you can see that as a sagittal section, you can see that. See, again, this is the labia minora, labia majora is over here. Here is your vagina. Protruding into the vagina is this thing right here. So this is the cervix, and this whole thing is the uterus. So sometime when you isolate this, I didn't really tell you and ask you what this is, and the student go, what? I don't know what this is, but I'll tell you now, that's the uterus over there, and that's the cervix. And location-wise, it looks like that, okay?
On top of the bladder?
Bladder,
Got a bladder.
it projected into this, right? So what you can see is that, now, this is, if you do a frontal sections of these, okay? You can say, here's the cervix. That's how you spell cervix, right?
Yes.
Okay. Infolding, so that's your sheet or your vagina, as in invagination, remember? Okay, this is the uterus. By the way, if someone who have pelvic inflammatory not bowel disease,
Inflammatory.
pelvic inflammatory disease. So normally if you get an infection from the vagina, it can come up and you can actually get this whole area get inflamed. So you can for whatever reason, maybe there's a lot of fibrosis there, you can remove the uterus. What is the process of removing the uterus called? Hysterectomy, right? Now, why is it that when a female laughs so much, it's known as hysterical?
Hysteria.
Because they pee.
Huh? It's because if you stimulate this, right, and you get a lot of sensation and they laugh out loud, that's hysterical. Yeah, that's what it has the same basis of hysterectomy. Anyway, okay. That's the uterus. That's the fallopian tube. This is the ovary. But, so this is the myometrium I want you to know. It's the thick layer. This layer right here, if you want to say inner layer, is the endometrium. Now the intermedium, if here's the lumen, which is the inside we see, right? The layer that is next to the lumen is known as the stratum, meaning layer functionalis. And the layer underneath is known as the stratum basalis for base, for example. Now, with estrogen we'll have two things to the stratum functionalis. Stratum will causes the thickening of the stratum functionalis. Then you have your progesterone, which causes the stratum functionalis to differentiate, to make it more secretory, if you will. So then these two hormones causes this layer to become multiply and to become more secretory. In anticipation for implantation. If you don't have any implantation, write this down. A drop in progesterone will trigger menstruation. Which is that when you progesterone, you don't have any more progesterone, this layer right here will shrink, right? Sometimes there's an artery that is goes into this area, becomes basically constrict, and then sometimes the people, some female might report pain, but it's the stratum functionalis that is sloughed off due to the drop in progesterone. Okay? And then, so the next round cycle, so this is like, let's say your menstruation is 3 days, for 3 or 4 days, and then you rebuild it. Okay, so the first 14 days after the menstruation, you're getting the rebuilding of the endometrium, so that it stimulates the stratum basalis to become more stratum functionalis now. Okay, is that clear? Kind of? All right. The most important thing here is that what causes menstruation is a drop in progesterone. Okay, so the next question is, where does the progesterone come from?
The ovaries.
The ovary. But what stimulates is that? So the next thing I want to do is, before you're going to study those models, and we're going to go into the histology, is this. This is the cross-section, if you will, of the ovary. And just like you would say that inside the seminiferous tubule, you have the stem cells known as spermatogonium. Well, on the periphery of you have, call it the oogonium. But in the ovary, the eggs do not develop by themselves. They usually develop in the follicle. Okay? So the egg is often found in the follicle, and there are many kinds of follicle. The follicle that you find sitting at the edge with the eggs inside is known as primordial follicle. Okay. Now under FSH stands for follicle stimulating hormone. It stimulates the primordial follicle to become bigger, if you will. Where the primordial follicle is surrounded by the granulosa cell. And it is these cells that produces estrogen. As you can see that more FSH, bigger follicle, right, primary follicle, which give rise to this, known as a secondary follicle. The oocyte, this is the oocyte, is still here. That's the oocyte. But the difference between primary follicle, so this is primordial, this is primary follicle, and this is secondary follicle. The difference between primary and secondary is the presence of fluid. There's a lot of fluid in this follicle. This fluid in the follicle is known as the antrum. Okay, so I'm going to show you and look for the antrum, the secondary follicle. Again, more FSH stimulate follicle development because FSH stands for follicle stimulating hormone. It stimulates this follicle, so then now this follicle has gigantus antrum. But note that this follicle is near the periphery. Okay? This follicle that nears the periphery, near the edge, is known as the Graafian follicle. Now this is ready to pop. That one is ready to go. Right? So as you can see that under FSH stimulation, this will get bigger, right? What about your estrogen level? It's going to be increase or decrease? Increase. So in fact, a surge in estrogen will stimulate the anterior pituitary to secrete LH, luteinizing hormone. Luteinizing hormone causes this thing to pop. So two things I'd like you to know about the luteinizing hormone. LH does two things. One, causes ovulation, which causes the oocyte to release. So in fact, this is known as secondary oocyte. In other words, the oocyte started meiosis too, but it doesn't finish it. Okay, so on Monday, for those students who have me lecture, I will tell you what happened. But for those who doesn't have me for lecture, note that the egg that is releases from the ovary is known as secondary oocyte, which means that it starts meiosis 2, but it doesn't finish. Okay? If it doesn't finish, there is no third polar body, if you will. LH does two things. One, it causes ovulation. Two, what it does is that it stimulates these things right here. These things now is without the eggs. We call this ruptured follicle. LH stimulates this ruptured follicle to become the corpus luteum. And it is the corpus luteum that secretes progesterone. Okay? Now, what causes menstruation? A drop in progesterone. A drop in progesterone, this whole thing sloughed off, right? Now, let's say that if a female ovulate, she has sex, right? So she's got fertilized oocytes. So this is the lab on Tuesday, okay? But the LH level now is gone. But you get fertilized oocyte. Do you want the endometrium to slough off? No, because it's sloughed off, then there is nothing for the implantation. So what prevented the endometrium from sloughed off should the female is pregnant?
An increase in progesterone.
There is an increase in progesterone, but there is no LH. So the question is, what hormone maintains the corpus luteum? Corpus luteum means yellow body. This yellow body produces progesterone. If you don't have this, no progesterone, you get menstruation, right? But if you're pregnant, at least first 5 days, maybe 2 weeks, there is no LH. So what maintains the corpus luteum?
The estrogen.
Huh?
The estrogen.
Estrogen? No. Okay, so this is what I want you to know. It's called HCG. Human chorionic gonadotropin. You can say that, or you can just say HCG. And in fact, it's the trophoblast of the zygote, or the blastocyst, if you will. Okay? So the fertilized oocyte secrete HCG. And HCG has similar function as LH, and that is maintains the corpus luteum. And in fact, HCG is so high in the blood, right? It can filter through the kidney in the proximal convoluted tubule. And it exceeds the transport rate of HCG. So consequently, Anila, what happened to HCG? Huh? HCG in the blood is so high, it gets filtered in the proximal convoluted tubule. It exceeds the extra transport rate.
And it's secreted in the urine.
Yes!
And a positive pregnancy test.
Yes. So the basis of pregnancy test is the presence of HCG. And since, HCG is same as LH, so there's some female which is sterile, she doesn't ovulate, right? Maybe missed menstrual cycle because her LH is low. Pregnant woman's urine sounds good to me. I'll buy it from you, right? What? Yeah, you can actually extract HCG from the female urine and inject yourself and stimulates the body LH. Alrighty?
I didn't know that.
You women are cool.
Alrighty. Okay, so 20 minutes, study the model and this, and now I'm going to show you the